A very good morning to all of you. Very warm welcome. We're all gathered today here for a very interesting information that we're going to share with you. 2020 has been a year of, more than saying difficulty, I would say a year which has made us stronger, more confident, more powerful. 2021 is a bright future, looks like it. All of us are positive about it. And the media, which has been a very strong component of 2020 in conveying all the right information to the people, to give them the information that they need to know to get over it, is here with us today. And we are happy to share something very important that is going to be an internationally, probably a benchmark of one of its kind. Professor Rela, Chairman of Rela Institute and Medical Center and Director of the Liver Transplant Unit at Rela Institute, will share this interesting information with you.
Thank you, Gomati. Good morning, or maybe it's going to be good afternoon for everyone. Thank you for coming. As Gomati said, it's been a tough time, but there has been some positive aspects for the whole thing. Now, if you take liver transplant, முதல்ல நான் இங்கிலீஷ்ல பேசிட்டு அப்புறம் தமிழ்ல பேசுறேன் உங்களுக்கு வீடியோக்கும். Liver transplantation has been becoming popular in India for now 10 years. Before 10 years, people were going abroad for transplant, and they were spending almost, I would say almost 1 crore to 1.5 crores. If you go now to have a liver transplant done in the US, it will cost almost 2.5 to 3 crores for a transplant. So we have worked very hard. I have worked in the UK for many years, and I came back to India to set up liver transplantation. And before we were talking about setting up liver transplantation, there has been some sporadic activities of liver transplantation everywhere in the country. Centers will start liver transplant operation and patients will die. So generally, the opinion of doctors and patients were the outcome of liver transplantation has not been very good. And this takes many years to disappear from public mind and from doctors' mind. Now, as the results improved, I think at least over the last 5 to 10 years, the results of liver transplantation in India has been comparable to the Western countries. When I say comparable to the Western countries, the outcome of liver transplant is one of the most difficult operations that any human being can have. I mean, you can think about heart transplants, lung transplants. Actually, liver transplant is much more difficult than heart transplant or lung transplant or kidney transplant or any transplant you can have. The patients are very sick before transplant, and you have to have an extremely experienced team to make the outcome of liver transplant successful. So that's why it's taken a long time for liver transplantation as a technique to become successful in India. But even though in the last 5 years, the outcome of liver transplantation in India has been as good as most of the Western countries, public still have a suspicion. When a patient sits in front of me, they'll have only 6 months to live, 1 year to live. And I tell them, you only got 5 months to live, 6 months to live, you should have a liver transplant. The first question they are asking me is it safe? Will I survive a liver transplant? So somebody who doesn't even have 6 months to live thinks that it's not worth taking a risk of a liver transplant. That's the situation which is still there among the public. And there are many doctors also who think that, the outcome of, whenever they hear somebody has died from liver transplant, they believe the outcome of liver transplantation has not been good. But we have been doing liver transplant for 10 years, and our team has done almost 2,000 liver transplants in the last 10 years. Our outcome has been comparable or better than most Western countries. Our outcome has been averaging around 90%. But with the team maturing, with the technology improving, with infections getting under control, slowly we have actually improved even the international benchmark. In the US, if a transplant center is to continue as a transplant center, they have to produce in the previous year 90% survival. If you produce a 90% survival, that is, if you do 100 transplants, if 90 patients survive, it's taken as an outstanding result. But we have gathered here, and what we have achieved in the last 1 year is we did 120 transplants consecutively. I'm not choosing 120 of the best patients. Consecutively, 120 transplants, we've only lost one recipient, one transplant patient. And that is 99% survival. It's more than 99% survival. And this has not been achieved anywhere to my knowledge, continuously to achieve that sort of success rate. You may say, okay, why are you boasting about this? I think it's important we convey this information because we need to remove the doubt that people have. We need to remove the suspicion that people have that transplantation, if I have, I will die. Because transplantation is life-saving. It changes the outlook. It's not like people thinking that, oh, they'll always be sick after transplant. That is not true. The outcome of transplantation is excellent. The long-term outcome of transplantation is extremely good. The quality of life for these patients is extremely good. And therefore, we need to remove the fear of transplantation in people's mind if you're going to stop them from dying of their liver disease and liver cancer. I think transplantation is done for a condition called cirrhosis. In children, it's done for liver disease, liver failure, and for liver cancer. I think we need to allow people to come forward and remove the fear of transplantation. And if we can achieve, I don't know if we can continuously achieve this, but I think it's an achievable goal. And maybe COVID may have something to do with it because COVID, we took very strict infection control precautions. So one of the most common causes of, because of immunosuppression, patients may be dying of infection complications, and once you eliminate it, maybe the outcome is very good. See, technically I think we have achieved very, very, very high standards. What we can't control is infections from outside. And COVID may have helped in improving a little bit. It may have played a little part in the best outcome.